Well, hi guys, Kenneth Kerr here, and as you can see, we're with Ryan here at Pharmasave, and Ryan, it's been a wee while since we did one of these. So
it's been a little while, yeah.
Yeah, now we're right in the middle of the summer, so lots of good things to talk about, and I know you want to talk about mosquitoes and West Nile, because we'd had something up on the site, I think it was from the government, that talked about, you know, obviously you can minimise the risk of the likes of West Nile by not having standing water and, you know, wearing more protective clothing, not going out at certain times and so on. But, of course, there are approaches that you guys have with repellents and so on, and I think that's what you want to give us some advice on today.
Yeah, basically, I mean, obviously the only way to decrease the risk of West Nile is to decrease the risk of getting bitten by mosquitoes. So that's where we're going to go into repellents, which is pretty much the most effective way you can do it if you're going to be outside, out and about. Right. So everyone's heard of DEET. It's the most common. It's pretty much in 90% of the products out there. So, you know, we'll discuss it a little bit. There are some health concerns with it and stuff that people, you know, want to go with a more natural route, but we'll just kind of go over the concerns. For children 12 years or younger, you pretty much don't want to use any products that are higher than 10%. And any kids' products you'll see, they're going to be 5, 7, 10% kind of thing. For children that are less than 6 months of age, you pretty much want to avoid DEET altogether. You know, get a mosquito net or something, cover the stroller, you know, baby carrier, whatever it might be. They're not moving around too much anyway.
Exactly, yes.
6 months to 2 years, try to use or limit yourself to 1 application a day. And then 2 years to 12 years, you can go up to 3 applications a day. Keep in mind that if, you know, kids are jumping in a pool right away or going swimming, that doesn't necessarily count because when they come out, it will have been washed off by the water, so you may have to reapply it. Generally, those lower concentration DEET products will last about 3 hours.
Okay.
The one thing you want to do is avoid children ingesting it. So you want to keep it off their hands if possible, not on things that they're going to put in their mouth. That's going to result in higher concentrations in the body. And then, you know, put it on their clothing, their hat, minimally on their skin, and then just wash it off when you're indoors. As far as there are some concerns that have been brought up with regards to pregnant women or women that are breastfeeding. There is no evidence that the use of DEET poses a health hazard to the unborn child or breastfed children, especially if precautions are used, like put it on your clothing, wash it off when you come inside. Basically, anything that's stronger than 30% has been phased out by Canada, Health Canada, because it doesn't prove to be any more effective anyway. So there's even less chance of there being any problems.
Right, so as time goes on, I mean, the use of DEET is getting actually safer.
It's gotten safer, a lot safer, yeah. Having said that, people still want to use alternatives, you know, natural alternatives, other choices. So one of the main ones everyone's heard of, citronella oil. It's effective, you know, lasts 30 minutes to 2 hours. And then you got other essential oils, lavender, eucalyptus, combinations of all three or a couple of the other. Usually they'll last around 30 minutes or so or a little longer. You've got the heated repellents, such as a Pharmasave, which is what I've got here. It's probably my favorite. There are also off lanterns, mosquito coils, that kind of things. But the Pharmasave, it uses a heat source, which vaporizes a repellent, which is a natural repellent that comes from the chrysanthemum flower. Clears out a 15 by 15 square foot area of mosquitoes quite effectively. We've tested it up north in the bush fishing. There doesn't get to be any more mosquitoes than that, so it works well. And then you've got a couple other things that are oil impregnated, like there's wristbands and then the family buzz patch, they call it. And those have the citronella oils and whatnot in them, but they do last longer because it releases the oil over a period of time. So they work pretty good. Some people hear about vitamin B1 or the B1 patch. Testing has not been able to prove it effective, but it doesn't hurt to try it. Some people swear by it. If you want to use it, you know, that's absolutely fine. It's not going to do any harm.
Good. So there's lots of different choices.
Yeah, there's choices out there.
People can take. So when people come in here, I mean, you know, specifically into Pharmasave, they're obviously going to get a lot of different choices. They've got, you know, the things you've shown us here, and then the traditional DEET products. So, you know, whereabouts in the store would that be? I'm at the back.
It's just over at the front corner, pretty much right when you come in the front door.
Okay,
so I mean, it's that time of the year. It's right when you come.
You want it right there at the front. And of course, if anyone wants to have any specific advice on it, they can
come
chat with you about it as well.
And then basically, if you get the bites, if all else fails, you want to treat them. Basically, you're going to be treating itchiness, redness. It's a localized allergic reaction on the spot. You know, we always use calamine, oatmeal, baking soda, antihistamines, oral antihistamines, all kinds of home remedies to help with the itchiness. The most effective thing now, which we can help you out with, is prescription strength 1% hydrocortisone cream. We can prescribe it for you. Just come in, ask us about it. It works better than anything out there. So yeah, it's been getting a lot of use and working great for people.
Good, good. So obviously the best thing, as you say, is to try and avoid them. If you can't avoid them, put on the stuff to repel them.
That's right.
But then if you do end up getting bit, then come in here and see you.
We'll fix you up.
So sounds like a plan. One more question for you.
Yes.
Okay. With all of this high-tech stuff, did it let you catch any bigger fish?
This year it did.
Okay. We'll see you next time, my friend. Thank you.
Thanks.
Take care.
Bye.